Gap. The report finds people of different races here in Utah not only have different health concerns, but they're not getting the same health care as other races. ABC4's Curtis Booker spoke with state health officials about this report. Joins us live with Utah minorities and how they can get the care that they need. Curtis?
Well, Brian, in general, Utah is known for being a fairly healthy state. However, for some, that access to health care doesn't come easy. COVID-19 continues to shine a bright spotlight on healthcare, or in some communities, a lack thereof. In a new detailed report, the Utah Department of Health finds a disproportionate number of Utahns in minority communities who aren't getting the health care they need. They say the disparities may be linked to finances, environmental, or geological disadvantages.
Likely there are those factors at play, but we're not able to make and should not make assumptions about that.
Brittany Okada with the Utah Department of Health says while COVID has heightened the need for preventative health care, the report reveals that health inequities for ethnic groups have been an issue well before the pandemic.
And we have seen that since 2005.
The report looks at more than a dozen factors related to illness, as well as more than 70 measures of public health care. Analysts found racial and ethnic health disparities exist in 71% of health and public well-being. The most notable factor in the study being the percentage of Utahns in ethnic groups without health insurance. According to the report, of the 9.4% of Utahns lacking health coverage, 35% of Hispanics reported not having health insurance, and 25% of African Americans don't have health insurance.
A lot of times that makes decisions hard for individuals, communities, populations about whether or not to access health care.
Okada says the department is working with more than 30 organizations through a partnership program that will enable underserved communities of health the access to reach their highest health potential.
And we're working in partnership together to address all sorts of health disparities across the state of Utah.
Now, Okada adds as more partnerships and community health workers work together, they could be better understood about some of these disparities in racial and ethnic communities across our state. Reporting live in Salt Lake City, Curtis Booker, ABC4 News.